So the survey was run deliberately with 3 different cohorts. The first of these cohorts was as a follow-up to the NHS Cancer Patient Experience Survey. This provided an average patient that we could compare against. The second cohort was a leukemia care database cohort, and part of this was to understand why these patients were reaching out to leukemia care, what the needs were, and whether the things that we were hearing from patients as a charity were reflective of the broader population. And the third cohort was an online anonymous link which was available for all blood cancer charities to promote to see how the cancer sector was supporting patients more generally. Some interesting conclusions came out of the survey, too many to mention really, but the key ones that we focused on were around the financial support available to patients and how the information provision needed to be improved, the emotional support available to patients, and again improvements required there, particularly around clinical nurse specialists and access for the chronic leukemia patients, and also around early diagnosis more broadly, but particularly for acute leukemia in terms of both public awareness but also primary care awareness of the potential symptoms and how to diagnose patients quicker. So the Living with Leukemia survey was the second time that we've run this survey. We are running it for a third time this September, from September to December. Hopefully we will have even more patients respond this time than we did last time, so hopefully more than 2,000 patients. By running the survey again, we're looking to track annual comparisons to see how patient experience is hopefully improving in the UK, but also to drill down into some of the areas further. Our plans for the survey this year are to expand it into a patient survey, but also into a carer survey and also into a healthcare professional survey to see how perceptions vary around some of the key issues affecting patients. As 2019 is Leukemia Care's 50th year, we've got a number of new services launching. We're particularly trying to address the emotional and financial aspects of leukemia, in addition to the other services we already provided. So we'll be launching a new counselling support service, a hospital travel assistance grants programme. We're going to be expanding buddy support programs across the UK, and we've also got a lot more conferences, information, videos, basically information in digital formats in ways that we've not really done before.